He just had a slight cough, so he came to the hospital to get checked out. After a urine test, Sean realized this was not something minor. The foam in the sample was way too much. Even if you pour a beer too fast, you would not see that much foam. It could very likely be emphysematous cystitis bladder cancer, or kidney disease. The patient was clearly shaken. He cautiously asked whether it could be related to his weight loss surgery. It turned out he used to be severely overweight and had trouble finding a partner, so he had to undergo gastric bypass surgery. But at this point, it was all speculation. They needed to perform a cystoscopy to find out the truth. Once in the operating room, they first injected contrast dye and found no obvious lesions or abnormalities. But Sean still felt something was off. He stepped in to take a closer look himself and quickly spotted the issue. Shortly after the contrast was injected, it disappeared, and that usually means there is a connection between the rectum and the bladder, allowing air and bacteria to enter, which is what causes the urine to foam. After the patient woke up, the doctor told him he had Crohn's disease. It is similar to severe inflammatory bowel disease. Now his gastric bypass needed to be adjusted. Otherwise, it could lead to infection or other complications. But the patient refused. He did not want another surgery. He was afraid his partner would find out that he used to be overweight, but there was no way to hide a surgery like this. Just as the doctor was trying to convince him, his partner arrived at the hospital. Looking back at his symptoms, everything finally made sense.